Hey guys, welcome back. This is Dental Unfiltered. I'm here with my normal co-host Andrew Vallo, and today we have an awesome special guest, Steven Jensen. Steven's the head of data for dental intelligence. Doc, if you're listening, there's all these reports in different markets. Wall Street, you have the tech sector report, you have the S&P 500. Unfortunately, there isn't enough reports in our industry about what's going on in the industry. And Dental Intel does a state of the industry report. And Dental Intel collects this data across 5,000 practices. So it's a tremendous data pool. We're having Steven Jensen on today to talk about data trends, what we're seeing in the marketplace with down economy, and also to do the state of the industry report with you guys here on Dental Unfiltered so you can see what's going on. So Steven, to start off with, tell us about like the tremendous amount of data you guys have, the state of the industry report, and what trends you're seeing, and kind of what you're seeing from this, honestly, this God level view of our industry. What are you seeing at the highest level across these 11,000 practices?
Yeah, let's jump in. So like you said, we've got just over 10,000 practices coming up on 11, which is a ton. You think about what we're able to see. We're to the point now where like regional data is starting to get interesting. We can see what's going on in the space. But before I jump into industry trends, I just want to make this comment. So you guys have seen Moneyball probably, right? Brad Pitt, story of baseball. It's classic, where Billy Beane, the general manager of the Oakland A's, decides that he wants to take a different approach to the way that he runs the team. It's all about the numbers. It's all about getting on base. So instead of going the classic GM route and like looking at like the classic look of a baseball player and going on this gut feeling. Now, obviously they were finding good baseball players, but it was a lot of like just gut reactions. Like, does this guy have the look? Is he going to be the right player for the team? He took this approach and said, no, we just need to get the right people on the team to make sure the numbers play out so that we get the most people on base and we can just win games with these marginal improvements in each specific role on the team. And what we're trying to do as a company at Dental Intelligence is help the dental industry make this big shift. I think we have for a lot of years had this build it and they will come mentality with our patients, right? Like you just make a dental practice, slap it on a corner street with high traffic, you're gonna get some foot traffic and they're gonna come. And that's just not the case anymore. Markets are changing. Inflation is up. So we are competing more than ever with the dollar spend with discretionary earnings. Are we gonna spend it on teeth? Are we gonna spend it on an iPhone? Are we gonna spend it on a trip for our family? Like that's what we're competing with. So we have to get more clever with the way we attract patients. We have to get more clever with the way that we retain patients. There's more dentists now than there's ever been as well, as we continue to grow. So the idea is, hey, if we can create an analytic solution and we can start bringing all of the data together of these dentists, we can start as a company giving insights to help people understand what's changing in the market. What are some of these like fine-tuned levers we need to pull? And how can we outperform what the average dentist is able to accomplish? So hopefully the goal today, hopefully I'm going to share some things, some insights into the market. Hopefully I'm going to share some practical applications on ways that you might walk away from this and say, hey, like, yep, what you said the average dentist is experiencing, I'm experiencing, and I'm going to see if I can't buck that trend like you guys are talking about. So that's going to be the goal, I think, of what I share. So with that in mind, let's jump into kind of some of the high level stuff that's going on right now. Okay. So first, I'm going to make a broad claim before I share any stats. We'll talk about cancellations and no-shows. We'll talk about case acceptance. We'll talk about what doctors are presenting, if they're presenting more or less. We'll talk about some of that stuff. But one thing I just want to call out that's really fascinating is that since COVID, the bottom performing practices have been all over the map in performance. Meaning, like, for the most part, they are struggling still to this day more than they have ever struggled. The average dental practice has kind of had this like up and then maybe like leveling off or slight down experience where the average dentist maybe had like a little bit of a high coming out of COVID. Like money was free, there were stimmy checks going out, people were spending. So I think the average dentist did have like a little bit of a boon there where we're seeing that come off a little bit. And then the top performing practices had the biggest boon, but still have been able to, I'm assuming through their like business savviness and creativity. I mean, there's going to be some things we'll talk about, but they've been able to continue to experience really high level performance that the average dentist and the bottom performing practices just are not seeing. So I want to recognize that in the industry, people that are listening, there might be some people that think that might be feeling like, man, like I've been in dentistry for 20 years and this is like the worst time. Like those people are out there. And there's also people listening to this podcast that are like, dude, this is like it is free and easy. Like I've never experienced a better experience than today practicing dentistry.
This has been my best experience in dental because I've only been in since COVID, but it feels awesome to me right now with my practice and stuff.
Like that does, when I'm looking at data, when I start to segment out like these different performers in the industry, like that exists. There's this group that's struggling and there's this group that's got this boon that just seems like it's just rolling still. And it's been rolling for years. Okay. So the question then I think for the average, today I'm probably going to talk more to the average and the low performing practice. So if you're a top performing practice, you probably will be interested in this. It'll be more like a pat on the back, like, oh yeah, like I've got some things figured out. But I'm probably going to speak to the average and bottom performers because that makes up 90% of the market. So let's talk to those guys. So here's a couple things that are going on in the space. One, cancellations and no shows have been on the rise for 3 years. So they pre-COVID were like 6-7%, and today they've more than doubled. They're averaging 14-15% for the average dentist. Okay, so that has a big material impact. A couple other interesting trends, and then we'll jump into some like practical stuff. A couple other interesting trends. There's been a trend of the super GP. I don't know if that's like the right word to call it, but basically bringing in more of the specialty work, some implants, some extractions, wisdom teeth, all on fours, stuff like that. Ortho has been a big one. Bringing that into some general practices has definitely been a trend, and we're seeing that in the data. So the number I look at is the average treatment presented per exam in a general practice has been going up consistently, and not just for the last 3 years. That's been going up year over year for the history of data that I can look at. And so the last couple of years, that's gone up a couple $100. We've gone from like $1,400 up to now over $1,600, well on our way to $1,700 getting presented per exam in an average practice. What's also interesting is that case acceptance has come down. There's a question about whether or not, we'll talk about this, whether or not that's because of patient behavior. Like, is that because they're tight on the pocketbooks, or is it because we're presenting more treatment? So we can kind of chat through that a little bit, I think would be interesting. Let me call out a couple other things, and then let's dive into some more like practical application stuff. Oh, here's another good thing. Patient retention. The industry is like slowly getting better in that. And that's one where we kind of pat ourselves on the back on that one. We don't know if that's like the industry or that's just because they're dental intelligence customers. And we are telling them that is the strongest correlation with practice success. Like if you want to pick a practice, like if I'm going to go buy practices and I'm like, okay, like what is like the bare bones number metric that I personally want to look at that's going to tell me that the rest of the numbers are probably going to be good? If I had to pick one number, I'm picking hygiene reappointment. And a lot of people might be like, what? No, like it's collections or EBITDA or like some of these other numbers that are like, that I'm looking at. No, I'm telling you, we have done so many studies to learn that hygiene reappointment, which that number is the percentage of patients that schedule their next hygiene appointment today while they're still in the business, that's the number. That number has the strongest correlation with financial success. Practices that have really, really high hygiene reappointment have phenomenal collections. They've got great case acceptance. I think because there's some nuances there. It tells you about the patient experience. They like you. They're willing to come back. They're saying, does that make sense? So that's the number. That number has been improving for dental intelligence customers year over year since I can look at data, as well as pre-appointment, which is just all of our patients, how many of them are scheduled to come back. So that's been going up. So that's a positive thing. It doesn't have to all be negative. Like we're getting better at retaining patients. And then maybe one more thing that I'll call out, and then I'll let you guys poke at stuff, ask questions, and we'll like chat. One more thing I'll call out is that patient base growth has slowed down in the whole industry. Meaning, coming out of COVID, there are all these patients that fell off the books, and there was this big land grab for patients. And so the average practice grew their patient base. The top 10% of practices exploded their patient bases. Like if someone wanted post-COVID to like grow a massive practice or like expand operatories, like the ocean was big and blue and wide for them to go do that. And then the one call out like I'll make earlier is that the bottom performing practices are the ones who lost in that big boon. And that is they did not grow actually. They bled out patients more than they had ever bled out patients. So or let them slip out the back door. So patient-based growth with the average practice and top performing practice, however, has slowed down over time.
Steve, that awesome stuff there. And, I think very valuable information for all of our listeners. I like this both from an industry wide view as well as, when you can view your own individual practices statistics. I think from an industry wide view, it's good to know when patient behavior is changing. I think one of the most important things you said was how cancellation rates have more than doubled. So that's huge, guys. Just realize that, and I'm sure many of you guys are feeling that right now. You're seeing more cancellations. I think just as a trend, as society, it's become more acceptable to cancel your appointment, to not show up for your appointment. I think COVID has been an excuse for a long time. Now, in today's time, if someone says, "Hey, I'm sick," there's not really a whole lot that we can say about that. And so, I think as a practice, you need to be strategic about your strategies to, one, help avoid cancellations, and two, to help keep your schedule full even with the increase in cancellations. So, like one of the strategies that we apply, and we've talked about this in previous episodes, but we have cancellation policies. We remind patients of our cancellation policies. We take deposits for any production appointments. Patients who don't confirm for non-deposit appointments get moved off the side of the schedule, and we fill those with other patients. So, I mean, like, there are still strategies that you can use to help offset this change in trends, but you have to know it. If you don't realize that cancellations are increasing, you're not going to make changes to how you do things. So that's why it's so valuable to know this information. From a practice level standpoint, I think it's even more important to know your numbers, your KPIs, your key performance indicators. And Steve mentioned something that I agree with 100%. I think your patient reappointment rate, how many of your patients are reappointing for hygiene, is the number one factor to practice success. And this is something that initially I didn't really look at. So, when we first opened my first startup, all I cared about was getting new patients in the door. And I wasn't focusing on how many of our patients were we retaining, how many we're scheduling for their next appointment. Now it's a goal for my offices. Every one of my general practices where we have hygiene, we're shooting to have 90% of patients pre-appointed for their next hygiene appointment, meaning that they're scheduled while they're in the office before they leave. But again, if you don't measure these things, you can't make decisions to change your systems to try to improve that. Yeah, no, I mean, I totally agree, Matt. And I think, again, Stephen, it's the knowing what KPIs are most important when you're giving suggestions to your clients as far as like what KPI should they pay the most attention to. Obviously, reappointment rate is one of them, but what other KPIs do you recommend that dentists really track closely? And what are some good targets for some of those KPIs as well?
I think one of the things that's been on my mind a lot lately has been cancellations and no-shows. In fact, like Dr. Vallo, you riffed on this for a second. You threw out a couple of, like, if listeners weren't listening, a couple of nuggets on how to actually kick that number, like outperform the industry. So one of the things, since that was going up, one of the cool parts about my job is I will go and I'll just go target, like, who are our top performers that are beating the industry. And then I just start hitting them up. I'm like, hey, can I interview you? Can I find out what you're doing? So I started looking at practices that were having a cancellation and no-show rate way lower in the industry. So I found a bunch of them, and there were like some consistent trends, which I'll comment on a few of those things, on like what those were, and you named a few of them. But I started interviewing them and finding out like what is it that they're doing that is allowing them to not experience the same thing that the industry is doing. Now, before I jump into that, I want to share this quote. So I'm a fan of this guy, Chris Williamson, and he says that the magic you're looking for is in the work you are avoiding. Right? So I'm gonna say that again. The magic you're looking for is in the work you are avoiding. So as I'm doing these interviews, like that quote just was like ringing in the back of my head, because the stuff that these doctors are doing to have a way lower cancellation no-show. So this one group I'll tell you about, 7 locations, their average no-show cancellation across all their practices is 4%. So like wicked, already low, like pre-COVID. And all they're doing is they are just putting that like extra tiny little bit of attention and effort onto making sure that they have a good system in place and a good way to track that. So I'm gonna just spout off a couple of things that they do as a team. So number one, the doctor, Dr. Markowitz is his name. And I've got permission to share this story of his. He said, number one, he just has this belief across the whole team that cancellations and no-shows are not an option. Like we don't do that at my dental practices. And so we have to have a 100% confirmation rate. And if someone, just like you said, so this is nugget number one, Andrew or Dr. Vallo, like you said, if someone doesn't confirm, then they move them off the schedule. And he's trained his patients that that's what happens. Like you don't get to come in unless you confirm. And what's super cool is he always he's a cool guy. It's not like it's this iron claw experience at his practice. Like otherwise his patients wouldn't want to come back. And so the conversation he's trained his team members to have is whenever they're reappointing, they just go through this quick little conversation where they say, hey, after the appointment scheduled, hey, and just so you know, you'll get a reminder text messages. They start 5 days before your appointment. And it's going to ask you to confirm. So you just have to respond with like a C or a yes to let us know you're coming. And those are super important. In fact, why don't I just tell you, imagine if you set up lunch with your friend 6 months from now and it's 5 days before and you text your friend, you're like, hey man, are we still good for lunch? What would you do if your friend just didn't respond? They ghost you. You text them again 4 days before, still no response. 3 days before, still no response. Are you going to show up to lunch? And the patient laughs and they're like, no, I'm not going to show up to lunch. And they're like, yeah, of course. So in our dental practice, if you're not responding, we're just going to assume that you're ghosting us. You're not showing up. And so we're going to go ahead and fill that spot with someone else. No harm. We're not trying to be mean or anything, but just if a friend doesn't text you for lunch, we're just going to assume you're not coming. And so he said they've used that exact little phrase or that little story with all their patients just to help them understand the importance of those confirmation messages. So when we look at their confirmation messages, they have a really high response rate to those. The cadence, he said, is really important. So they go 5, 4, and 3 days. He said the reason why they do that is because he wants 2 days to be able to manage the schedule if someone hasn't confirmed. So he said that cadence they have found is also super helpful, where most people think oh, I'll just do 2 days before, a day before, and then 15 minutes before, a last minute, which he does do some reminders. That's different than a confirmation message. He does do reminders right before, just in case people get busy, but that's really important. And then, so we've got 100% confirmation. And then here's the other thing. He has this whole workflow as well. So basically 5, 4, and 3 days is automation. So then he says, look, a lot of people these days think that work is dead. Making phone calls is dead, and actually doing hard work that kind of sucks is dead. And he's like, it's not dead. We still all have to do some work that sucks. It's not super fun. And he said, so I'm always, whenever possible, as a leader of my team, trying to automate tasks that I can automate, trying to use technology when I can. So with confirmation and stuff like that. And he's like, but at the end of the day, there's always going to be this small portion of patients where someone's going to have to call them to confirm that appointment. And it's a bummer. And he's like, but it's worth the time. So I use automation first. And then once I've hit that 5, 4, and 3 days, they haven't confirmed. He's like, then inside, this is one tool inside of dental intelligence. I'm not trying to do a plug, but just so people understand what he's doing. He's using this tool called follow-ups, and it just automatically is scanning for patients that if they've confirmed or not. And if they haven't confirmed at 2 days, then it automatically creates a task for a team member to reach out to those patients. And he said he has them make 3 attempts, meaning they just call, because a lot of people don't answer their phone that first time. So he makes 3 attempts. And if they've made 3 attempts on that second day before the appointment and there's no answer, no confirmation, at that point, they move them off. The last thing I'll comment on is verbiage. So what you're actually saying in those confirmation texts matters. So if anyone's interested in getting, some verbiage that is proven to work, that's one cool thing that I get to look at is hey, what are people sending out that's having a high response rate to those confirmation messages? And what does it actually say, right? So for example, it's not rocket science, but their confirmation message, their first one just says, hello, John, this is Steve's Dental reminding you of your appointment on, the date. We can't wait to see you. New paragraph, please call or reply C to this text for your appointment. This is all this classic, but then he adds this little asterisk. Please note that we do require confirmation in order to keep your appointment. We do not accept cancellations via text. Thank you. And then he ups the ante slightly on each one. So 5 days, 4 days. By the third day, it starts off: to avoid a short notice cancellation fee, please reply C to confirm your appointment with, Steve Dental for date. Please note that we do require confirmation in order to keep your appointment. We do not accept cancellations via text. Thank you. So he starts to slowly kind of up the ante, get a little bit more stern in those confirmation messages if they're not responding. And that's working really well, combined with the team's behavior of training those patients. And so if you're sitting there man, I've got this cancellation no-show problem, once again, I'll just remind you, the magic you're looking for is probably in the work that you're avoiding. It's these small steps of just committing to a process and to a cadence that you and your team are going to follow through on. And you can improve that number. Absolutely, you can buck the industry trend. And they're not the only ones doing it. There are several thousand that are doing way better than the industry. So lots you can do with cancellations and no-shows. Yeah, go ahead.
I was going to say that's great. It sounds like he, copied my confirmation policies and protocols almost to a
Sounds
T.
like it.
I guess great minds think alike, but cadence, that's the same thing we do. 5, 4, 3. The email or the text progress as you go. The last one's literally patient's name. We've been trying to confirm your appointment. We don't want you to lose, this appointment spot. If we don't hear from you today, we may have to offer your appointment to somebody else. We don't say we will offer it, because if we don't fill their spot, we still want them to, come or, confirm or whatever it is. But we say we may have to offer it. The other thing we do is we try to use automation without sounding automated. So all of our confirmation text, all of our reminder text, all of our review requests, they all sound like they're coming from our front desk person versus just automated text. This is the dental boutique, or whatever. So I feel like that has increased, the actual read rate, because if you think about it, guys, how many of these automated texts do you get from different, things that you either are a member of, subscribe to, whatever it is? Automation's becoming a big part of our world. And I think our brains automatically kind of tend to ignore these automated things quite often. So I think making it sound like it's actually coming from, your front desk person makes a huge difference as well. I think the other thing that, he mentioned that's really important is that you can improve the things that are broken in your practice if you give them attention, if you try to, fix the systems, tweak the verbiage, whatever it is. But you have to know what's broken in order to know what to put the attention on. So, another thing that I realized as I, looked at our KPIs and dental intel that was broken was our hygiene department and our perio percentage, our fluoride percentage, our perio percentage, our recall. Basically, when we first opened, it was just the Wild West, and I just kind of let our hygienists do their thing. And then I started tracking all these numbers, and I realized man, our reappointment rate's really low. What's our protocol for reappointing these patients? Oh, we don't really have a great one. Let's set one up and let's make it crystal clear to everybody. This is how we pre-appoint our patients. Oh, our fluoride percentage is really low. What's our protocol for offering and encouraging fluoride? Oh, we don't have one. Let's make sure we have a standard protocol that all of our hygiene team knows. This is how we encourage fluoride. We encourage fluoride to everybody. This is the verbiage we use, blah, blah, blah. Same with the perio. It's guys, studies have shown that over 40% of adults over 30 years old have some form of periodontal disease, and our perio diagnosis percentage is 8%. Obviously, we're missing something here. So, once you know your numbers, once you can study your numbers, what's not working well in your practice, and what to put that work into. To Steve's point, things take work, and in order to make improvements in your practice, you've got to put some work in. But don't focus your work on the wrong things. You've got to figure out what are the biggest issues in my practice right now, and what do I want to put my energy, my attention, my money, whatever it is into.